Hello my dear future nursing officers, welcome back to my channel. I hope you all are doing great. Without wasting your time, let's start first MCQ. Jaundice in human beings is result of option A, incomplete metabolism of bilirubin, option B, incomplete metabolism of biliverdin, option C, complete metabolism of bilirubin, option D, complete metabolism of biliverdin. Answer is option A, incomplete metabolism of bilirubin. Move to next MCQ. In human body, the temperature regulation center is situated in option A, thalamus, option B, hypothalamus, option C, pons, option D, cerebrum. Answer is option B, hypothalamus is regulated body temperature. Move to next MCQ. Tachycardia refers to option A, more than 100 pulse per minute, option B, more than 125 beats per minute, option C, less than 70 beats per minute, option D, less than 40 beats per minute. Answer is option A, more than 100 beats per minute we called tachycardia. If heart rate less than 60 beats per minute, it is called bradycardia. Move to next MCQ. Bradycardia refers to option A, more than 100 beats per minute, option B, more than 125 beats per minute, option C, less than 60 beats per minute, option D, less than 40 beats per minute. Answer is option C, less than 60 beats per minute in adults, less than 70 beats per minute in children and less than 90 beats per minute in infants. Move to next MCQ. Hospital acquired infection are termed as option A, nosocomial infection, option B, fungal infection, option C, bacterial infection, option D, viral infection. Answer is option A, nosocomial infection we called hospital acquired infection. After admission of 48 hours, patient gets any infection called nosocomial infection. Move to next MCQ. The complete loss of hair from head is called option A, anorexia, option B, alopecia, option C, agnosia, option D, apnea. Answer is option B, alopecia is a loss of air and apnea means temporary cessation of the breathing. Mostly we are seen in Chinese stroke breathing. Agnosia means unable to find out objects, we call agnosia. Next, anorexia, it is a eating disorder. In this condition mostly we are seeing amenorrhea. Administration of medication underneath the patient's tongue is called as option A, buccal administration, option B, sublingual, option C, subcutaneous, option D, transdermal. Answer is option B, sublingual is a fastest absorption. Move to next MCQ. Ringer's lactate solution is an example for option A, isotonic solution, option B, hypotonic solution, option C, hypertonic solution, option D, none of these. Answer is option A, isotonic solution. Move to next MCQ. Glasgow Coma Scale includes all except option A, eye opening, option B, verbal response, option C, motor response, option D, touch response. Answer is option D, touch response we cannot see in Glasgow Coma Scale. Remaining three options are we will assess in Glasgow Coma Scale. Minimum score is 3 and maximum score is 15. Move to next MCQ. Who was the first nurse in the world? Option A, Virginia Henderson. Option B, Stephen Girard. Option C, Florence Nightingale. Option D, Betty Newman. Answer is option C, Florence Nightingale. Florence Nightingale born in the year of 1820, 12th May in Italy and died on 1910, August 13, England in the city of London. Move to next MCQ. Who is the author of the book Notes on Nursing? Option A, Florence Nightingale. Option B, Dr. Ashok Ganguly. Option C, Rajkumari Amrit Kaur. Option D, Virginia Henderson. Answer is option A, Florence Nightingale is correct answer. Move to next MCQ. Profession is defined as an occupation with which component? Option A, economy. Option B, code of ethics. Option C, psychological. Option D, social. Answer is option B, code of ethics is a component of profession. Next question. International Council of Nurses was established in option A, 1867. Option B, 1899. Option C, 1950. Option D, 1962. Answer is option B, 1899 is the established year of International Council of Nurses. Move to next MCQ. The headquarters of International Council of Nurses is located at option A, London. Option B, Geneva. Option C, Chicago. Option D, Alberta. Answer is option B, Geneva is the location of headquarters of International Council of Nurses. The first step of nursing process is option A, planning. Option B, assessment. Option C, implementation. Option D, evaluation. Answer is option B, assessment is the first step of nursing process. Move to next MCQ. Nurse is assessing a patient's abdomen. Which examination technique should the nurse use first? Option A, palpation. Option B, inspection. Option C, auscultation. Option D, percussion. Answer is option A, palpation is the first technique used in abdomen assessment. Next, what is the full form of LAMA? Option A, leave against medical advice. Option B, leave and medication advice. Option C, leave alone with medication application. Option D, leave against medication apply. Answer is option A, leave against medical advice is the full form of LAMA. Move to next MCQ. The exit of client from hospital is option A, admission. Option B, discharge. Option B, absconded. Option D, llama. Answer is option D, llama is correct answer. Move to next MCQ. A fire breaks out in your ward. The first action you take is option A, call 101 fire brigade. Option B, shut off the oxygen supply. Option C, do use the fire with fire extinguisher. Option D, evacuate the patients from the ward. Answer is option D, evacuate the patients from the ward. Next MCQ. Which of the following code is associated with cardiac arrest during medical emergency? Option A, code black. Option B, code blue. Option C, code green. Option D, code red. Answer is option B, code blue is correct answer. Move to next MCQ. The use of isolation in hospital is intended to option A, discourage a client with an infection from ambulating. Option B, keep an infection from becoming endemic. Option C, prevent further spread of infection to others. Option D, maintain a sterile environment. Answer is option C, prevent further spread of infection to others. It's a typing mistake, not D answer is correct. Correct is prevent further spread of infection. Option C. Next, which type of isolation precaution is used for clients with measles? Option A, none of these. Option B, protective environment. Option C, contact precaution. Option D, airborne precaution. Answer is option D, airborne precautions. There are three types of transmissions: airborne, droplet and contact precautions. Move to next MCQ. One of the following is not included in standard precautions in healthcare settings. Option A, wearing a N95 mask. Option B, recapping of used needles. Option C, performing hand hygiene. Option D, practicing proper cough ethics. Option B, recapping of used needles. Move to next MCQ. Purposes of using gloves are all except option A, to provide a protective barrier. Option B, to reduce risk of transmission of microorganisms. Option C, to avoid allergic reactions of the hands. Option D, to reduce the risk of exposure to blood-borne. Answer is option C, to avoid allergic reactions of the hands. Move to next MCQ. When a nurse is performing a surgical hand hygiene, she must keep hands option A, above elbows. Option B, in a comfortable position. Option C, below elbows. Option D, at 45-degree angle. Answer is option A, above elbows should keep hands. Next MCQ. Which of the following is considered as the most important aspect of hand washing? Option A, soap. Option B, water. Option C, friction. Option D, time. Answer is option C, friction is the most important aspect of hand washing. Next, how many movements of hand hygiene have been laid down by WHO? Option A, 7. Option B, 8. Option C, 6. Option D 5. Answer is option D 5. Now we will see movements of hand hygiene. The 5 movements for hand hygiene are: before touching a patient, before cleaning and aspects procedures, after body fluid exposure, risk after touching a patient and after touching patient surroundings. Move to next MCQ. The recommended sequence for removal of person protective equipment on leaving a patient's room is: option A, gown removed first, gloves removed last. Option B, gloves removed first, gown removed last. Option C, mask removed first, gloves removed last. Option D, gloves removed first, mask removed last. Answer is option D, gloves removed first and mask removed last. Next MCQ. Core body temperature is highest at: option A, early morning, option B, afternoon, option C, late afternoon, option D, evening. Answer is option C, late afternoon is a core body temperature highest. Next, which route one used to identify hypothermia in a newborn? Option A, oral, option B, oral, option C, rectal, option D, surface probe. Answer is option C, rectal is correct answer. Move to next MCQ. The most reliable method of taking temperature: option A, rectum, option B, mouth, option C, axilla, option D, none of the above. Answer is option A, rectum is correct answer. The rectal method of taking temperature is most reliable because the rectum contains large amount of blood supply. Move to next MCQ. Rectal thermometer is inserted into the anus of an adult client. Option A, 1.5 inch, option B, 1 inch, option C, 2 inch, option D, 2.5 inch. Answer is option A, 1.5 inch inserted in rectal thermometer. Next MCQ. Site of pulse used for routine assessment of vital signs in the adult. Option A, brachial pulse, option B, radial pulse, option C, carotid pulse, option D, apical pulse. Answer is option B, radial pulse. Carotid pulse we will use in emergency time if patient is collapsed. Move to next MCQ. Which of the following is the most reliable pulse in infants? Option A, carotid pulse, option B, dorsalis pedis pulse, option C, apical pulse, option D, radial pulse. Answer is option C, apical pulse we will use in infants and brachial pulse used in children's. Move to next MCQ. The site of pulse in the neck is called: option A, temporal, option B, radial, option C, carotid, option D, popliteal. Answer is option C, carotid pulse. We will use in emergency conditions if patient is collapsed. We will check carotid pulse not more than 10 seconds. Move to next MCQ. Cleaning enema is ordered for 55-year-old client. Before intestinal surgery, the maximum amount given is option A 150 to 200 ml, option B 200 to 400 ml, option C 400 to 750 ml, option D 750 to 1000 ml. Option answer D is 750 to 1000 ml of enema we will give adult patients. In children's we will give 500 ml to 750 ml. In infants 250 ml to 500 ml of enema will use. Move to next MCQ. Patient complain abdominal cramp during giving enema. Nurse should do immediately. Option A stop enema giving. Option B clamp the tube till pain subside. Option C slow the rate of enema. Option D call the physician. Answer is option B clamp the tube till pain subside. Move to next MCQ. Most commonly used urinary catheter is option A Malicot catheter, option B metal catheter, option C Foley's catheter, option D Pesser catheter. Answer is option C Foley's catheter, most commonly used in urinary catheter. Move to next MCQ. The series of sound heard during measuring blood pressure is option A whisper, option B rales, option C Korotkov, option D sniff. Answer is option C Korotkov sounds we will hear during measuring blood pressure. Move to next MCQ. Precautions apply during measurement of blood pressure. Option A patient should be in supine position. Option B blood pressure instrument keep above patient level. Option C record eye level measurement. Option D none of this above. Answer is option C record eye level measurement. Move to next MCQ. If investigation is not possible after sampling, the blood should be kept in it. Option A 1 to 4 degrees Celsius, option B 4 to 6 degrees Celsius, option C discard, option D freeze. Answer is option B 4 to 6 degrees Celsius. Move to next MCQ. Sodium fluoride vial is used for measurement of which substance in blood? Option A glucose, option B urea, option C HbA1c, option D hematocrit. Correct answer option A glucose is correct answer. Move to next MCQ. Therapeutic effect of ART application is option A vasoconstriction, option B increased lymph flow, option C decreased blood flow. Answer is option B increased lymph flow. Now we will see explanation of this question. Therapeutic effect of hot and cold therapy. Now we will see hot application. So in hot application, so blood vessels are vasodilated and in this condition blood flow and lymph flow and capillary permeability will increase and O2 consumption also increase and local metabolism and WBC also increased in hot application and blood viscosity and muscle tone is decreased. And cold application, in this cold application Blood vessels are vasoconstricted and blood flow and lymph flow and capillary permeability and O2 consumption decreased and local metabolism and WBC motility and muscle tone decreased and only blood viscosity will increase in this cold application. Next MCQ, 1 liter contains deciliter. Option A 1, option B 10, option C 100, option D 1000. Answer is option B 10 deciliters contains in 1 liter. Move to next MCQ. Which of the following medication orders is administered immediately and only once? Option A PRN order, option B single order, option C stat order, option D standing order. Answer is option C stat order, correct answer. Move to next MCQ. What is the time frame within which the telephonic or verbal orders for medications should be verified and signed by the physician? Option A 4 hours, option B 8 hours, option C 12 hours, option D 24 hours. Answer is option D 24 hours is correct answer. If we receive telephonic verbal orders, so within 24 hours should take physician signature. Next MCQ. Subcutaneous injection is administered. Option A epidermally, option B hypodermally, option C in the muscle, option D intradermal. Answer is option B hypodermally we use subcutaneous injection. Move to next MCQ. Which of the following IV fluids is an isotonic solution? Option A 25% dextrose, option B ringer lactate, option C 3% normal saline, option D 0.45% normal saline. Answer is option B ringer lactate is correct answer. There is 3 types of IV fluids: isotonic, hypotonic and hypertonic. In isotonic under ringer lactate, normal saline 0.9% and 5% dextrose with water. So, comes under isotonic, and 0.45% normal saline and 0.225% normal saline comes under hypotonic solutions, and 3% NaCl, 25% dextrose, DNS and 10% dextrose comes under hypertonic solutions. Move to next MCQ. Which test is used to check the collateral circulation to the hand? Option A capillary refill test, option B Allen test, option C Squamroth test, option D Romberg test. Answer is option B Allen test. We use to check patency of the ulnar. Next MCQ. During ABG analysis, blood is collected from option A artery, option B vein, option C capillary, option D any site. Answer is option A artery we will use for ABG analysis. Next MCQ. Which drug should be used for rinsing the syringe before taking blood sample for ABG analysis? Option A adrenaline, option B dopamine, option C, dobutamine, option D, heparin. Answer is option D, heparinized syringe we will use to take ABG sample. Move to next MCQ. In ABG analysis, which parameters are assessed? Option A, sodium bicarbonate and pH. Option B, sodium bicarbonate, CO2, oxygen and pH. Option C, sodium bicarbonate, CO2 and pH. Answer is option B, sodium bicarbonate and CO2, oxygen and pH. These levels are checked in ABG analysis. Move to next MCQ. Normal range of PaCO2 in a ABG sample. Option A, 30 to 40 mm of Hg. Option B, 40 to 45 mm of Hg. Option C, 35 to 40 mm of Hg. Option D, 35 to 45 mm of Hg. Answer is option D, 35 to 45 mm of Hg is the correct answer of PaCO2 in ABG sampling. Next MCQ. Allen's test is useful in evaluating. Option A, thoracic outlet compression. Option B, presence of cervical rib. Option C, integrity of palmar arch. Answer is option C, integrity of palmar arch. Move to next MCQ. Before giving blood transfusion, nurse must note the date, time of collection and must be aware the packed red blood cells can be stored up to option A, 25 days, option B, 35 days, option C, 45 days, option D, 55 days. Answer is option B, 35 days packed red blood cells can be stored. Move to next MCQ. How often can a donor give blood? Option A, at any time. Option B, every 2 months. Option C, every 3 months. Option D, every 6 months. Answer is option C, every 3 months can give blood to recipient. Next MCQ. Oxygen saturation is measured by option A, pulse oximeter, option B, thermometer, option C, manometer, option D, pulse transducer. Answer is option A, pulse oximeter to measure the oxygen saturation. Okay, my dear future nursing officers, today's session is completed. Tomorrow we will meet with new session. If you like this video, please do subscribe, like, share and click the bell icon. Don't forget to comment. Thank you.